pitching health stories to your editors. I think health gets a bum rap in terms of it being seen as a soft topic. It's much less sexy than rather politics. In my newsrooms, we always used to joke that when we all came into journalism, we all wanted to be the political journalists. And then we kind of found this love for health reporting. These are basically the sort of 5 ways that news editors judge what's news. So we call this like newsworthiness. The first is timeliness. Is it happening now or is it just happened? Excuse me. So you can think about this for those health days. So those health days provide a timely news peg or a timely element of timeliness. Proximity. How close is the story to your readers? Geographically, experientially. Obviously, something that happens in Johannesburg is less interesting to your editor, right, than is happening in your hometown. Significance or scope, and I think this is the one that I think journalists don't do enough of when they pitch. So how many people are affected by whatever you want to talk about? The more people are affected, the bigger the story. So I have a lot of journalists who have found like an amazing story. Somebody has come to them and they've had this amazing experience, and now you want to write about it because it's just such a great story. Maybe somebody's overcome this illness, and you pitch it to your editor. You're like, so-and-so has just done an amazing story. She thought she was going to die, but she overcame, and I would love to tell her story. As a news editor, that is less appealing to me than when you say to me, Mary overcame cancer, cervical cancer. And did you know that 5,000 other women in South Africa also have cervical cancer? So it's called scope. It's like, how many people does this affect? If you can do your homework and share and show that the thing that you want to talk about affects more people than maybe just your case study or just the person that you want to interview, that already sends off sort of a bell in your editor's head. Prominence, if a high profile person is involved, that's another way that people judge newsworthiness. And then human interest. Again, this goes back to those universal truths, particularly gripping, interesting, unique stories that evoke emotion. And then I think, again, to kind of check these boxes, I think you need to go through them when you kind of formulate how your attack plan of how you're going to pitch your story to your editor. And I think you need to do I would sit down and take some time to research what you want to write about, so that you are equipped to make arguments along these lines, and then also to answer questions that your editor has. So, because your editor is going to have questions that hopefully move the story forward, but also might be part of the process of convincing them. If you've done your homework before you pitch, I think you're ready to answer those questions better. Also, I would also like just to throw in there, health can be a political story, not just the corruption that we see in the healthcare system, but also there's a lot of ways in the way that health is structured that, if you really dug deep, there's a lot of industry influence in certain parts of healthcare, whether that's medical aids or hospital groups, or big corporations. And that's something that tends to make a story sort of feel more political for readers. And if you're interested in learning about that, the Competition Commission did a great, very comprehensive, very long report that's available on their website into how industry factors influence private healthcare and the cost of healthcare in South Africa. So I always think that when you kind of can reveal those unseen influences, that becomes something a little bit more political and less necessarily health, as more editors kind of think of it.